This is our patient Rita, who is back to see us for an interview. We saw her as a new patient a little over a year ago. Hi Rita, how are you?
How are you?
I'm fine. So what has changed in your life since we saw you a year ago?
My life.
Your life has changed.
My life has changed. And I was very, very frustrated, depressed, in a very bad place because of prior the experiences that didn't go right, and I couldn't talk, I couldn't eat, and my profession is a profession that you use to talk. That's what you do. You talk, and I couldn't do that, and obviously being a woman and a very vain one, I didn't like what I see in the mirror, and now my whole attitude changed. I am a happier person, and I like what I see. I look in the mirror again, and I started to work again, and I have a little bit of difficulty talking because I'm not used to the denture, but it's getting to be better and better. And and I have to thank you for it because you were patient, you were very, very, how you say in English, supportive, and you calmed me down when I was crying, and that meant a lot to me. Mm, of course, the operation, the thing is fantastic, but your attitude towards me in the beginning, I only have to thank you, doctor, because you went, you you stepped out of the box and you became a person. So a person was talking to me, not the dentist. And I have to thank you. And then after what happened, that I had that problem in the hospital, the patients and cheering me and saying, you're going to be okay, you're going to be okay. Well, doctor, I am okay. Thank you.
Well, thank you very much. I also think your husband was very supportive.
Yes.
During this
yes.
Process as well. And I know one of the things you told me was difficult when we first saw you a year ago. You couldn't speak. You couldn't work.
No.
And now you say you can work and it's comfortable.
Yeah.
And the denture that you had before was causing a lot of pain.
A lot of pain, and it so because it causes a lot of pain, I didn't eat. So
Yes.
I lost 20 pounds. And in the process of losing the 20 pounds, I got very depressed. And I became antisocial. I am a social person, but I was another Rita. I didn't want to see people. I didn't want to go out. And when I went out, I didn't talk. I just got quiet in a corner and saying to myself, oh my God, I want to go home, I want to go home. So now I talk too much.
Well, that's good. I know we were just talking a little bit about, I think your first language is Portuguese?
Yeah, Armenian. Armenian and Portuguese.
And Portuguese.
Yes.
One of my best friends is an Armenian,
Yeah.
and he's an oral surgeon. He actually is the one who taught me to do the
Yeah.
procedure.
Yeah.
So one of your brothers helped you.
See?
Yeah. So what would you tell patients if they were experiencing problems like you have? What would you tell them? What would your be advice?
I advise to find a dentist like you, first of all. And I did not know, you forgive my ignorance, but before I have no idea who Dr. Duello was, because I was stuck with one dentist who, unfortunately, he is a very good man, but it didn't work with me. And I advise to see a doctor who knows and is caring, and also I advise not to be scared of the financial obligations. I was very much scared of the financial obligations, but you were very kind, and it's worth it. You have to do it. I advise to see and do something about it because it changed your life.
Well,
For you to stay with that denture to suffer because of financial obligations. I know it was very hard for us, but it's worth it every penny.
well, thank you very much, and we appreciate your time and your effort to help yourself. And I think things like this are important for us to sit down and, one, celebrate your success, and two, to share this with other patients who may be in the same situation but don't know what they can do or
I
where they
am
can.
at your service anytime if you need anything. I am more than happy because what I am surprised, doctor, is that it doesn't hurt. I had visions of hurt because I lived with hurt, you know. And I don't have a hurt. I know I have a denture because it's not my mother, but it's okay. It's okay. And
Well, it's a very strong story. It's a very passionate story, and we're just thankful that we had an opportunity to treat you and some of the things we can do to help you.
and I thank you, doctor, because I never forget our interviews in this room end up with me crying every time. And and today I'm here and I'm smiling, and I want to thank your assistant also because she was like doting little sister to me. I'm older, of course. I'm only 49.
Well, Rita, thank you very much, and we're going to share this with as many people as
Thank
we
you.
can. You're
Thank
welcome.
you.
Thank you.